begin momentarily. We will take questions submitted by members of the media after he makes brief remarks. I'll now turn it over to Dr. Alex Garza.
Okay, good afternoon, everybody, and thanks for tuning in for today's briefing. As I mentioned on Friday, we're officially 1 year into the COVID-19 pandemic in the United States. Now, we talked Friday about everything that's happened within the past year. Now, before we get to today's numbers, I wanted to spend a minute today talking about what we can expect going into the next few months and why I hope that people will remain optimistic and focused on getting through the next phase of the pandemic as quickly as possible. Now, for months, we've been saying that winter will be our darkest time in the pandemic. And that has proven to be true nationally and here in St. Louis. But while we have a long way to go, I also want people to see that there are signs of hope. For one thing, the number of COVID-related hospitalizations in our systems is starting to trend down again. The fact that this is happening in the winter, when respiratory viruses typically spread the most, shows us just how effective all of those prevention measures actually are when people use them. The trends we are seeing indicate people are taking the virus seriously and doing whatever they can to prevent the spread. People are wearing masks, they're making hard decisions about not seeing their friends and family and slowing this virus down. Now, no one can say for sure whether we are through the worst of the pandemic, and it might spike again. But the most empowering thing that we can say is that for sure is that we control whether that spike happens. Now, if we continue to double down for a while longer on the steps that work, we will be able to keep the virus from spreading and keep more people from becoming sick. Another incredibly positive sign of hope is the fact that the next few months we will get a lot of people vaccinated against the virus. Now, there will be many, many challenges with that, as many of you have seen. And it will probably go slower than most of us would care for, and it will be uneven and a little bit rocky at times. And we will likely continue to struggle with getting enough vaccine, which no one enjoys hearing about. But people will need to be patient and continue to be diligent about preventing the spread of the virus. But it will get better. And vaccinations will increase at a faster rate, and we will get to everybody in the population. And I believe that we will still get vaccine into the arms of a large percentage of people in the population on our way to herd immunity. And I also see signs of hope in our hospital staff as well, who, despite being exhausted, continue to care for those that are hospitalized. Don't forget, they are a year into this pandemic as well, and they've seen thousands of people become sick and die. Yet they continue to care for each patient with the same passion that they've had all along, and they continue to bring hope to so many more people. Now, there's no question we have a long way to go, but there are many reasons to have hope and keep doing what we're doing to prevent the spread of the virus. So now let's take a look at where we stand today. So as always, we start off with our graph showing our admissions, which again is dated over the past 48 hours. And today we're reporting a daily admission number of 67. And our 7-day rolling average is now 77. And so as you can see from the graph, we are continuing that downward trend with admissions, which is a very good sign. Moving on to our hospitalization data, today we're reporting 591 patients hospitalized with confirmed COVID. The moving average now is at 616, and again continues that downward movement. A little bit more information now on our daily numbers. Again, we have 591 patients hospitalized with COVID. We have 127 patients in our intensive care units, and we have 82 confirmed COVID-positive patients on ventilators today. Looking at our suspected COVID patients, today we're reporting 36 patients hospitalized suspected of COVID. We have 5 suspected COVID patients in our intensive care units, and we have 3 suspected COVID patients on ventilators today. Moving on to our good news slide. Today, or yesterday actually, we discharged 67 patients from the hospital that had COVID. And that brings our cumulative total to 17,202 patients discharged from our task force hospitals. And so again, special credit to all of our healthcare workers and their support that help get patients well enough to go home. Unfortunately, we still have people that are passing away from COVID. Today, we're reporting 7 deaths from COVID yesterday in our inpatient population. And that moves our 7-day moving average to 12. But again, this number is decreasing as well. And so that is what you have when you have decreasing cases, decreasing admissions, decreasing hospitalizations. Your death rate also comes down as well, which we highlight in this slide. It is Monday today, so we usually go over our modeling slides on Monday from the previous week. On last Thursday, the modeling team did update the model because of the decreasing census in our hospitals. And as you can see here, it is at a sharper angle coming down now, which is good news. That means we're decelerating at a faster rate. And so the blue line represents the new model predictions, and the orange line is the previous model. And so as you can see, it is at a sharper rate of decline, which is good to see. Moving on from there, I'm just going to go briefly through a couple of the other modeling slides. So this is our Epicurves by county. And they all follow a general pattern, which is a decreasing number of cases. So that is good news. We're not as we've mentioned before, this is the dark part of the winter, and so we're happy that the numbers have come down, especially during this time of the year. But it's important for us to also recognize that we got a ways to go. We do, though, see those signs of hope with those numbers coming down and the vaccinations starting to go up. It's important to recognize that we can control how well we're going to do for the rest of the winter and into the spring and the summer. And we can do that all by continuing to practice all of those prevention strategies that we've been advocating. So wearing a mask, social distancing, and not gathering in crowds while we wait for vaccine numbers to catch up. And I know we've been asking a lot of patients from the population as we try and struggle through this pandemic. But we can see that light at the end of the tunnel, and it's getting closer with every day. And so we really appreciate everybody's help in trying to keep those virus numbers down. So with that, that'll finish my comments. I don't believe we have any questions from the media. So thank you again for joining us, and we will see you all on Friday. Thank you.